Welcome to the Goldenness platform, your ultimate channel where you kickstart your day with positivity, wellness, health tips, well-being, and a lot of inspiration. I am your host, the Goldenness, and my mission is to help you lead healthy, happier lifestyle. Please do well to subscribe to our channel and don't forget to ring on the notification bell below to stay updated. Today on the Goldenness channel, we have Dr. Matilda Yaa Gyanwah, who is going to take us through or walk us through our topic for today, which is oral hygiene or oral health. Doc, welcome to the Goldenness channel and thank you for accepting our invite.
Thank you too for bringing me to this platform.
So Doc, let me ask you, when we talk about oral hygiene, which is our topic for today, what is it at all we are talking about? What is oral hygiene?
So when we talk about oral hygiene, it actually encompasses right from when you start eating to the point where you swallow food. So all the structures like the mouth, the tongue, the teeth, how you are able to keep it clean and healthy. Okay, so when we talk about oral health, their hygiene, it actually means that all the practices that you need to do in order for your oral hygiene to be optimum or to be best or to be to the standard. Okay, so one thing that we also need to know about oral health is that when we talk about oral health, it's linked to when you keep it well, you'll be able to one way or the other avoid certain diseases. Okay, because some of these oral health diseases are linked to systemic illness like diabetes. Oh. And then also, if you are able to keep your oral health well, what happens is that it boosts your confidence. I don't think that anybody would want to be moving around with halitosis, bad breath, and then be walking around. Everybody will start seeing you, and then it wouldn't boost your confidence.
People will be running away from you.
Obviously. So it's good that you keep your oral health basically optimum, like good. Yes. And then also, once your oral health is also good, it also helps to prevent certain diseases, oral health diseases like oral cancers and then diseases of the mouth. Okay, so like I said, there are practices that you need to do in order to keep your oral health to the maximum or to the standard. And one of the best practices is brushing your teeth twice daily, meaning you are brushing your teeth twice daily. And you know that when you want to brush your teeth, there are things that you need in order for you to brush your teeth. And that includes a toothbrush, water, common water.
Doc, before you continue, talking about the toothbrush, which one is good?
So, like I said, with the best practice, the toothbrush, it depends on the age category we are dealing with. We have children. You see, the kind of toothbrush you would use for a child is quite different from what you are going to use for an adult. You get it? And even for toddlers. Okay, so for children like below 10 years, normally we recommend that you would use a soft bristle toothbrush. Mm-hmm. One with softer bristles.
Yes.
And then for adults, we would recommend that we use medium bristle toothbrush. So those using hard, it doesn't really, I don't know, but the truth of the matter is when we are brushing our teeth, we are not really brushing to get a whiter teeth, but to get rid of the debris, the plaque and calculus around the teeth. Yes.
So, Doc, if I can understand, using the hardest toothbrush does not help us.
It doesn't help at all. It actually exposes you to other risks like you eroding all your tooth surfaces, getting you, like people get sensitivity as a result and all that. So using a hard bristle toothbrush, it's actually a no.
It's a no-go. Using a hard toothbrush is a no-go. That is what Doc is telling us today. So we should try to use the medium ones for adults. Okay.
Yes. And then also one important thing that I think I need to also talk about is the toothpaste, and that our right amount, the quantity of toothpaste that we need to use when brushing our teeth. Like I mentioned, every age category and the amount of toothpaste that individuals we need to actually use. Okay, so for toddlers, for children about 3 years and even 6 to 9 years, they actually require, from zero, I don't want to use zero, but from when they start teething till they get to 5 years, they are supposed to use about a grain size amount of toothpaste.
That is very little then.
Very little grain, like
yes.
rice grain.
Yes.
Grain. And then 6 to 9 years, they're supposed to use a pea size amount, just very small. And then adults too, we are supposed to use a pea size amount. But then another important thing is that for you to be able to know, I don't want to really recommend a particular brand of toothpaste, but then it's important that we check the label to know the right amount of fluoride in that toothpaste. And by standard, we are supposed to use about 1,350 to 1,500 parts per million amount of fluoride in our toothpaste. You get it?
So we should go after the number you said.
Yes, go
after buying toothpaste.
Very true.
Okay.
Yes.
Okay. Thank you. You see, then I will say, even myself, I've been brushing my teeth in the wrong way. Yeah. Because concerning the amount of toothpaste we should use, most of us, we are doing it wrong. So thank you, Doc, for educating us. And Doc, how does stress influence our oral health, and how can we manage it?
Okay, so one thing about stress is that when someone is stressed, there are hormones, I don't want to say hormones, but chemicals that are released in the body. Okay. And these chemicals, when they are released, what happens is that they sort of impair or reduce your immune system. So in as much as when there wasn't any stress, you're able to fight against infection. And bacteria, there are normal bacteria in your mouth. Okay, so when you are stressed out, this also rises, and then they can cause infections, gum infections. And then also another important thing about stress is that, well, when people are stressed out, they sort of go into one way or a habitual habit, a habit of grinding or clenching their teeth. And then this begins to wear off the enamel, the inner outermost layer of the tooth. Okay. And when this happens, it reduces the function of the teeth. I don't know if you get what I'm trying to say. Yes. I want to try and make it as simple as possible for you to get.
For the ordinary person to understand it.
Yes. So once people start, like they clench, once they are stressed out, they tend to involve themselves in a habit where they start clenching their teeth. Okay. So when that happens, what happens is that it erodes the tooth surface. It causes wear of that tooth. And then when that happens, they also begin to feel some sensitivity around their teeth. Apart from the immune system, which is going down, that also happens.
And Doc, also, what I know is also that when people are stressed, then some people get into the habit of eating sugary food also. And how can that also affect the teeth and the gum?
No, sugar is something that, well, for, like I said, there are bacteria in the mouth. So once they see sugar, I would say they are very happy.
Yeah.
So then they start acting on them. And once they act on them, they release acid. Bacteria act on those sugar foods. Then it breaks them down into acid. Okay. Acid too is virtually not good for the teeth. So it start breaking down the tooth enamel layer, then it start breaking it down. And that's when people start developing caries and all that.
Thank you. How can we reduce bad breath? Because you did mention bad breath earlier on. How can we reduce it through proper oral care?
Okay, so so for bad breath, one important thing for us to notice that there are different causes for this bad breath. And for us to be able to assess and then manage it properly, we would have to first and foremost know all the things that came together to cause it. We usually say that early morning when you wake up, before you brush your teeth, that kind of breath because you haven't been opening your mouth, so your mouth was virtually closed throughout those periods. It's a normal form of halitosis, if I should put it that way. But then when you come, and then you would have to assess and then find out from the individual if people around him or her have also assessed and then realized that, oh, indeed, there's truly a bad breath. Because some people psychologically believe that they have bad breath. And then also certain foods can also predispose you to this bad breath, like spicy food, garlic. I'm not saying they are not good, but then those food also it causes bad breath. And then also it can also depend on also be due to how you also take care of your teeth. If you are not brushing well, your tongue, most importantly, your tongue, you're not brushing it well, you're not brushing your teeth well, you have dental caries, you haven't addressed it yet, it can lead to a halitosis. So then,
mention of brushing the teeth well before you proceed. How do I know?
Recommended way of brushing teeth. I actually brought a model here, and I don't know if it's going to help.
Thank you.
But then, so the recommended way is that you have to angulate the toothbrush at an angle of 45 degrees, okay? And then this bristle of the toothbrush should be around where the gum line is. It helps to sort of like increase the blood flow around the gum, way of massaging the gum.
It?
Yes, massaging the gum. So you angulate it at an angle of 45 around the gum area. And then you start brushing the teeth in a circular motion around the teeth, in a circular motion. And that is what we call the modified bars technique. But then the most important thing is that it should be angulated at 45 degrees to the gum line, and then you brush in a circular motion. Usually it should, at most, when you're brushing your teeth, or brushing all the teeth, it should take at most 2 minutes. 30 seconds for one side, 30 seconds then. And you shouldn't only concentrate on the parts that you see. This side, where you grind your teeth, where you chew, the chewing side should be brushed, and the back part too should be brushed. I've realized that in my practice, I've seen a lot of people developing calculus, starter around this side, because they always concentrate only at this side and at the grinding, but forgetting this a backward side. So I always say that brush here, and then brush there.
How often should we visit the dentist for cleaning?
So it's important that about twice in a year, you're supposed to, about 6 months, every 6 months, you're supposed to visit your your dentist. It's important because once you're able to go there, when there's any disease of the teeth or gum which is starting up, or early detection, we can easily detect it as early as possible. And once we are able to detect it, we are able to solve it quite faster, and then it makes work easier for all of us. Unlike waiting till people can wait and then they get swellings and all that, we wouldn't recommend that. So as much as possible, we recommend that every year you're supposed to visit your dentist twice.
So at least twice a year, you have to visit your dentist.
Exactly.
Yes. Thank you, Doc. We are about to wrap up now. And if there is take home for today, if there is that's one thing you want us to have it at the back of our mind concerning oral health, what will it be?
I would recommend that as much as possible, the dentist is your friend. So get one and then get a dental clinic and visit any dental facility of your choice so that you can get your oral health checked. Yes.
Thank you. So the dentists, they are our friends, so we should visit them regularly to improve on our oral health overall.
Yeah. Overall.
Yes. Thank you, Doc. Thank you very much. The Golden Nest and the family appreciate you so much. Thank you, family, for joining the Golden Nest today. Together, we can create a world where our health is our priority and wellness shines bright. Until next time, stay golden and stay healthy.